People with Marfan syndrome are at a 50% risk of passing on Marfan syndrome to each of their children. There are ways to modify that risk. For example, if a mutation is known that causes Marfan syndrome in a parent, that allows prenatal diagnosis to be performed to determine if a developing fetus has Marfan syndrome. There's another method called preimplantation diagnosis, where eggs are harvested from the mother, they're fertilized outside of the body, and allowed to grow to the 8-cell stage of development. Then a single cell is taken from each embryo and undergoes genetic testing. Only embryos that don't have Marfan syndrome are then reimplanted into the uterus, and there's no consequence of removing a single cell at the 8-cell stage. So people with Marfan syndrome have the ability, they have the power if they choose to decide not to have children with Marfan syndrome. There is a risk to women with Marfan syndrome who become pregnant. Pregnancy puts extra stress on the body, including the aorta, and that can lead to rapid growth of the aorta or even tear or rupture of the aorta.